May I invite Dr. Yuganki Kush, which is going to cover the role of contact lenses, specialty contact lens in the dry eye.
Good morning, everyone. I will be covering specialty contact lenses in dry eyes. So in this presentation, we'll try to find out which conditions of dry eyes need specialty contact lenses, what kind of specialty contact lenses can be used in dry eyes, what is the mechanism, how do they work, what are the advantages they offer, and are there any long-term or short-term changes on the ocular surface, what are the limitations in these cases. So coming on to the conditions of dry eyes, any condition which is compromising the ocular surface, causing drying and desiccation, and not controlled by the medical management can be given good rehabilitation via the contact lenses. The condition like severe dry eyes, which are refractive to the conventional treatment, Sjogren syndrome, keratoconjunctivitis sicca, even in limbal stem cell deficiency cases, contact lenses are found to give good results. Neurotrophic keratopathy, cicatrizing conjunctivitis, and also in cases of post-refractive surgery, dry eyes, and chronic graft versus host disease. Now, which type of contact lenses to be used in these conditions? Like it has been all previously discussed in other slides, the scleral contact lenses is the answer to the question. This is a small video showing the how clinically we use scleral contact lenses. This has been previously discussed by my colleagues. So this is the plunger. Plunger needs to be filled with a fluid attached to the lens, and then a fluorescent strip to look for the reservoir. Coming on to the mechanism of action in these cases, so there is a fluid cushion effect. Fluid cushion effect over the cornea by vaulting all through it. So it provides hydration to the ocular surface by maintaining the reservoir, by causing decreased inflammation. So there is a decreased need of using lubricating eye drops, thus providing the dried ocular surface an opportunity to heal and breaking the vicious cycle of the inflammatory mediators. Also, there is a mechanical protection of the cornea as the lens provides a surface so that the keratinized lids cannot rub over the cornea. So how does these lenses help in these conditions? They provide restoration and support to the ocular surface, help in visual rehabilitation and correction of the corneal irregularity. They also provide pain attenuation, and in cases of Bell's palsy, leg of ophthalmos, and lid trauma, they prevent the desiccation due to exposure because they are covering the irregular surface. Also, they protect the cornea from microtrauma caused by blinking. Now, are there any long-term or short-term changes to the ocular surface by the use of these lenses? So the short-term effects on dry eye biomarker is there is no change in the Schirmer or the T-BERT, but there is decrease in the tear osmolarity and the OSDI symptom score, that is the ocular surface disease index. There is significant rise in the matrix metalloproteinase 9 concentration in the tear film. The long-term effect, the study says that there is the use of proscleral lenses. There was improved OSDI score from 56.54 to 24.98%, and the corneal staining pattern were decreased. So this is a case from our clinic where this, in this first image, you can see that this is a poor ocular surface with central corneal scarring and this corneal thinning, and the patient's vision was 660 initially, and with the scleral contact lens, we were able to give him a vision of 612 parts. So there is another case with a poor ocular surface, and in this case, we could give the patient a visual rehabilitation up to 6/9, whereas the unaided vision was counting finger 3 meters. So this is a short video. Few slides have been discussed, but this is covering the ocular surface disorders where scleral lenses can be used and how they provide visual rehabilitation in these cases. So there was a 7-year-old boy of Steven Johnson syndrome whose unaided visual acuity was 3/60. With scleral contact lens, we could give him the visual acuity of 618 to 612 in right and left eye respectively. Another case where the unaided visual acuity was 6/60 could be improved with the scleral lenses up to 6/6 both eyes. And another case of Steven Johnson where the visual acuity improved to 6/9. Also in cases of chemical injury, the lenses have seen to be providing good vision. So coming on to what are the limitations we face in these cases. First is the cost effectiveness of these lenses. Although the first case report dates back to 2000 by Rosenthal et al., but this technology is relatively new and advancing, as has been discussed by Dr. Tulika. More training to use these lenses in terms of the person providing the care, as well as the patient needs to be very careful. Also, there can be difficulty to fit in ocular surface problems where there are shortened fornices and multiple conjunctival problems. One of the major limiting factors is eye care providers are not aware about the therapeutic benefits of scleral contact lens in these conditions. So I would like to conclude that scleral lenses can be successfully used in the management of severe dry eyes and ocular surface disease. In addition to providing visual rehabilitation, they protect the surface by maintaining a fluid reservoir. Thank you.
Thank you very much, Dr. Yuganki. So now we know that in very severe dry eye, we have options until we say that patient has no potential of vision. We should try these options and patient do wonderfully well. So thank